Let me ask you about health care. We've got a new NBC poll just out last night that said that 31% of the country think the president's health care plan is a good idea. 31%, about a third, a little lower than a third. But almost half, 46%, say it's a bad idea. Now, we've had months and months of discussion of the health care bill and all its facets. People have looked under the hood, and they don't like it. What do you do with that situation?
Well, Chris, we've had this discussion before. I don't think they're looking under the hood. I don't think they know, and I don't blame them for it. I think the process has been very tough. The insurance industry has spent tens of millions of dollars to try and form opinions on this. But what is interesting is when you ask people about the actual elements of the plan, they're always very positive. You know, in Massachusetts last week, there was an election that you paid a lot of attention to, and everybody did. One of the interesting things that didn't get much attention is that 68% of the people who voted in that election said they really liked the Massachusetts health care plan. Well, that was the template for what we're trying to do here. 68%, and that's why Senator Brown voted for it and why he said he wouldn't vote to repeal it. So I think there's plenty of evidence that people like what the plan would do. They simply don't know what the plan would do, and fear has overtaken the situation here. And the only way we can deal with that is go ahead and enact reforms that people can see. So they'll see what does happen and they'll see what won't happen. Their fears won't be realized, but I think that they'll be very pleased to know that if they have pre-existing conditions, they get coverage. They can't get thrown off if they get sick. There'll be a cap on their out-of-pocket expenses. If they're a senior, they'll get more help with their prescription drugs. Medicare will have 10 more years of life.